Hello, Sonoma County. My name is Ryan Duval, and I'm a licensed acupuncturist and herbalist here in Sebastopol. I have another acupuncture point that I'd like to share with you that you can use on yourself or on other family members or friends that can help with lung strength. There's been, a lot of people dealing with coughing. People's asthma is a lot worse right now as a result of the wildfires and structure fires that have been going on around the county. And this point can be helpful for helping people that are dealing with the asthma or coughs, as well as just generally strengthening a person's immune system. Between the stress and the smoke inhalation, it's a hard time on people's lungs and immune systems. And so this point can be helpful for that. The point, it's kind of hard to, it'll be slightly difficult to see on the video, but I can describe it to you, and I'm going to physically show you as well. But if you actually follow along and try to feel it on yourself, it will be a lot more clear to you. The point is on your back, and what you're going to do is feel for the scapula, and the scapula is just the shoulder blade, and you're going to feel for the upper border of the shoulder blade. If you need to, you can kind of move your arm around a little bit to find where that is. And then you just kind of run your fingers along towards the spine until you get to the very edge. So you're right at the edge of the bone where the muscle begins. Now, right in there is the point that I'm wanting you to find. If it feels like there's not much going on right there, just try sliding your fingers down a little bit more, and chances are you'll find it. So this point is also on both sides, and you can do it on either or both sides at the same time. I've got a little helper here who would like to help me demonstrate so that I can show you on another person. Come on over, Trinity. So when you're finding it on a person, if I pull her shirt a little bit tight and have her move her arm, you can see the shoulder blade kind of pop out, and that can be kind of helpful in finding the point. So you're just going to feel for the upper border. Make sure you're not up on the scapula, or I'm sorry, up on the shoulder blade, but you're still on the scapula. And you just slide your arms across, move your fingers until you're right at the very edge, and there's the point. And so you can just massage that point, and you can do it on both sides at the same time. You can do with your fingers or a finger and a thumb. If you kind of can help the person, they can either lay down on a bed or you can brace them with your other hand, so that way you can get in there. And when you're massaging, you'll probably find a place that's a little bit ropey or feels a little bit strange, and sometimes, especially children, but older people too, they might get a little bit squirmy when you're actually on the point, because it can feel a little bit just unusual, to find something that needs to be worked out of your system, and your body kind of knows it. And so a lot of times there's a little bit of squirming or movement that can happen when you're right on the point. And that's kind of what you're observing with Trinity, as she's squirming right now. So just do it at a pressure that you feel like you're actually moving something through the person, and at the same time, not going too intensely. Like you want them to still be able to enjoy the experience. And just massaging the points for several minutes, maybe 5 minutes at a time, can be pretty helpful.